बिस्मिल्लाहिर्रहमानिर्रहीम। सकलाने वेलकम करूँ छू सैफी बुरहानी मेडिकल एसोसिएशन अमेरिका ना तरफ सी मोला ये एक अहम और जरूरी खिदमत में हमने शामिल किया छे। मुहर्रमात सी बचीने अने बीजाने बचावन ए खिदमत में शामिल हम सगला ने फरमाया तेनी शुक्र हमें अर्ज करिए छे मौलानी हजरत में। SBMA ये पिछला 8 वर्ष सी उसूल नसाते खिदमत अर्ज करे छे। मुमिननी सेहत अने खबरगिरीनी नियत सी खासतन आशराना स्कॉलरशिप्स, लाइव मेडिकल कॉन्फ्रेंसेस अने कोविड ना दरमियान PPE अने सेफ्टी प्रोटोकॉल्स इम्प्लिमेंट करवानु अने हर एक जमात में अने मस्जिद में AEDs प्रोक्योर करवानी खिदमत हमने नसीब थई छे। बोर्ड ऑफ डायरेक्टर्स अने सगला मेंबर्स ना तरफ सी आ खिदमत हमें शुक्र अर्ज करे छे मौलानी हजरत में। ममलूक सैयदना आमिर जमाली लॉस एंजलिस में इंटरवेंशनल कार्डियोलॉजिस्ट छू अने SBMA ना सेक्रेटरी। सगला SBMA ना लीडरशिप ना नामो आ मिसल आपने देखाई छे। आ वेबिनार में मौलानु पैगाम जे आपे सैयदना नूर मोहम्मद नूरुद्दीन ना उर्स ना दिन फरमाया एनी जिक्र था। तकरीबन पौनो कलाक नु प्रोग्राम छे अने तेना बाद शॉर्ट क्वेश्चन एंड आंसर सेशन हसे। अगर कोई ने कॉन्फिडेंशियल एनोनिमस क्वेश्चन मोकलवो होय तो एनु भी जरियो फीडबैक ना फॉर्म पर मौजूद हसे इंशाअल्लाह। शेख मुस्तफा अली भाई हाफिजुल कुरान SBMA बोर्ड मेंबर अने बैरियाट्रिक सर्जन डैलस में मौलानु पैगाम हमने पहुंचाओ से अने तकरीम कर से इंशाअल्लाह। सब
बिस्मिल्लाहिर्रहमानिर्रहीम। आज साइंस અને રિસર્ચના લોકો આ એડિક્ટિવ સબસ્ટન્સીસ ને જે લોકો ઇસ્તેમાલ કરે છે they describe these people as having a disease of the brain. તો આ એડિક્શન ની disease બીમારી ને એક સ્પાઈડર વેબ ની મિસાલ એ સગલા ડિસ્ક્રાઇબ કરે છે। કેમ કે સ્પાઈડર વેબ માં જે ફસી જાય છે તો जितनी ज्यादा निकलવાની કોશિશ કરે છે तो ज्यादा फंसी जाए छे, स्टक થઈ જાય છે। तो आ बीमारी डिजीज आ वेब सी कोई निकालनार होय तो ज निकली सकाय छे। तो हमारा वली हमारा मौला सैयदना मुफद्दल सैफुद्दीन आका आ मिसल हिदायत देनार मौला छे। हराम ना वेब सी बचावनार आप छे। खुदा आपने कयामत ना दिन लग बाकी राखजो। तो मौला ये ई सिगरेट्स निकोटीन वाली बद चीजों ये हमारा दरमियान कितनु फैलाई गयु छे तेनी मारिफत करावी अने पैगाम पहुंचायु। पहले आप ये दुआ फरमावी कि सगला ने हिफाजत में राखे ने सगला ने बचावे। पछी मैसेज पैगाम पहुंचावानो अमर फरमान कीधा। पछी आ जुमला फरमाया कि जे मुमिन ना दिल में दर्द पैदा करे छे कि ममलूक आले मोहम्मद ने आ बात घनी भारी छे, मारा पर वाजिब छे तेसी में कहूँ छू। पछी सैयदुल अजल शहजादा आली वकार शहजादा जाफर सादिक बाई साहेब इमादुद्दीन साहेब अदामुल्लाह उलुआ मजदही ये जिक्र फरमावी। इना अंदर आप ये एक नादिर जुमला फरमाया कि अपन वो छे कि जे मौला सी करीब थईए अने मौला अपने करीब राखे। तो आ बेवे हवे नेक्स्ट स्लाइड पर राखो। आ बेवे तस्वीर जे नजर आवे छे जमनी बाजू में मौलानो आपनु तबस्सुम नो चेहरो छे अने डाबी बाजू पर जेवारे आ ई सिगरेट नी जिक्र फरमावी आ पैगाम पहुंचायु तो आपने कितनु बारी छे कितनी फिकर छे ए साफ नजर आवे छे। तो आपना फरमान जे छे पैगाम पहुंचावानो एने माथे चरावीने सैफी बुरहानी मेडिकल एसोसिएशन ना मेंबरो आ आपनु पैगाम हमारा हद में पहुंचावी रह्या छे। हमने અને તમામ મુમિનીનને આપના તબસ્સુમ હાસિલ કરનાર બાકી રાખે. ખુદા તાલા આપ મોલાને કયામતના દિન લગ બાકી રાખજો. હવે જિકર કરશે ઇન્સિયા બહેન શેખ ડોક્ટર મુફદ્દલ મુસાભાઈ કે જે શિકાગોમાં એક હાઈસ્કૂલ સ્ટુડન્ટ છે અને તે દીકરી હાફિઝુલ કુરઆન બી છે. તો એ એના પર્સનલ એક્સપિરિયન્સીસના જરિયાથી she will provide us with a first-hand view of the severity of the issue.
Bismillahirrahmanirrahim. मैं Chicago my student too, and I want to talk about my experiences firsthand. So being in high school, I had a friend since first or second grade who was a very close friend to me, and when I was in my freshman year of high school, I found out that she was vaping and that she had been vaping for quite a while. And I still continued to be friends with her for a while until one day I was put in a situation where me and her were hanging out in a bathroom stall before school, and she offered me her vape. And she handed it to me and she said, I want you to try this. I think that you'll like this flavor and it won't hurt you if you just do it once or twice. You won't get addicted to it, and I want you to try it. And I was very scared. I didn't really know what to do because I'd never been taught what to do in any of these situations. And so luckily in this scenario, I had one of my friends there who was with me, who stood up for me and said, no, she's not comfortable. She doesn't want to do that. But I like to think if I was in a situation like that by myself, what would I have done? And the truth is that I don't really know, because I was never really taught what to do in this situation or how to act or how to say no and go against the effects of peer pressuring. And also I was never really taught what an e-cigarette or a Juul or a vape, what any of that was and what the medical effects of that were. So I wish that maybe my parents had talked to me about that from before and had had that conversation with me and told me what it was and what to do if I was ever in a situation like that. And I also wish that I talked to my friends a little bit more, because all of us were going through the same situations and the same scenarios at the same time, and none of us really knew what to do. And so maybe we could have learned through that. And so I hope that through this, the parents will initiate those conversations with their kids, because it does happen to almost everyone. The likelihood is so high. And I hope that kids ask these questions to their parents and to their friends and try and learn more about the situation, so that maybe if you're ever put in that scenario, that you know what to do and how to act properly. And now I want to introduce Dr. Sheikh Mufaddal Gumberwala, who is an orthopedic surgeon from Houston.
શુક્રન ઇન્સિયા બેન. તમે જેમ ઝિકર કીધું, ઘણું ઓછું શેર કીધું કે આપણા બચ્ચાઓ મિડલ સ્કૂલ અને હાઈ સ્કૂલના અંદર ઘણા બચ્ચાઓ આ ચીજથી એક્સપોઝ થાય છે. એ સર્વેમાં આવ્યું છે કે 3 મિલિયન બચ્ચાઓ યુએસએમાં within the last 30 days આ ચીજે વાપરું હશે, and approximately 25% middle school, high school kids વાપરતા હશે. વધારેમાં વધારે આ ચીજો ઈ-સિગરેટમાં ફ્લેવરના જરિયાથી માર્કેટ થાય છે. જેમ ઇન્સિયાબેને કીધું કે ફ્લેવર બતાવવાનું કે આ ચીજ અચ્છું છે, એનાથી મજા આવશે. તો આ ઈ-સિગરેટ એકચ્યુઅલી શું છે? નેક્સ્ટ સ્લાઇડ. ઈ-સિગરેટ ઘણા શેપ્સ, કલર્સ, ઘણા અલગ શેપ્સમાં આવે છે. એ અસલ શું છે કે એક ડિવાઇસ છે કે જે લિક્વિડને ગરમ કરે છે કે તમે પી સકો છો. નેક્સ્ટ સ્લાઇડ. એના અલગ અલગ શેપ્સ આવે છે અને કોઈ યુએસબી હોય છે, કોઈ સિંગલ યુઝ હોય છે, ડિફરન્ટ કલર્સ અને ડિફરન્ટ ફ્લેવર્સમાં આવે છે. નેક્સ્ટ સ્લાઇડ. અસલ એમાં શું છે કે એક માઉથપીસ છે જેમાંથી લોકો સિગરેટ પીએ છે. એના અંદર લિક્વિડ હોય છે અને લિક્વિડ ગરમ કરીને એના પછી એક એરોસોલ નીકળે છે. નેક્સ્ટ સ્લાઇડ. એરોસોલના અંદર અને લિક્વિડના અંદર મેઇન ચીજ શું છે કે નિકોટીન. નિકોટીન એક સ્ટિમ્યુલન્ટ છે કે બે ફિઝિકલ અને મેન્ટલ એક્ટિવિટીને એકદમ જ્યાદા કરે છે. એકદમ આમ થકાન ઉતરી જાય છે, આમ લાગે છે કે એક્સાઇટેડ થઈ ગયા છે. એમાં શું છે કે હાઈલી એડિક્ટિવ ચીજ છે. એમાં બ્રેઇનના અંદર કેમિસ્ટ્રી આખી ચેન્જ કરે છે અને એકદમ ક્રેવિંગ જ્યાદા કરે છે. અને ખાસ middle school high school age જે એજમાં બચ્ચાઓનું brain develop થાય છે એમાં long lasting effects દેખી શકે છે. Next slide. અને જે સિગરેટ પીએ છે તેને જ નુકસાન નહીં થતું. એક તો જે એરોસોલ નીકળે છે એનાથી જે આસપાસમાં લોકો હોય છે એનું બી નુકસાન થાય છે. અને જ્યાં જગા બી કરો છો એના એરોસોલની રેસિડ્યુ બી બેઠી જાય છે. પછી તમે કોઈ જગા નમાઝી કપડામાં બેઠો છો યા કોઈ નાના બચ્ચા પાસે બેઠો છો એને બી નુકસાન આપ પહોંચી શકે છે. હવે નેક્સ્ટ આપણે ડોક્ટર શેખ આમિર જમાલી કે જે SBM AA ની સેક્રેટરી છે એ હવે નિકોટીનની હાર્મફુલ ઇમ્પેક્ટ્સની जिक्र કરશે.
तो आप लोग स्लाइड पर देख ही सको तो कि बॉडी ना हर एक आजा हर एक ऑर्गन से निकोटीन ना नुकसान થઈ શકે છે. ખાસ કરીને lungs માં because this is carried through water vapor, the inhalation of water vapor can cause bacteria to go deep into the lungs and can cause bronchitis and pneumonia. And it's also an irritant and it can cause asthma and asthma exacerbations. Nicotine has profound effects on the brain. It is extremely addictive. It's at least as addictive as heroin and cocaine when you look at the addictive chemistry of it. And many other chemicals which are present in e-cigarettes have been linked to cancer, both in the respiratory tract and elsewhere. In addition, many e-cigarettes contain THC or CBD, which is the active ingredient in marijuana, and that can also blunt brain function. E-cigarettes can create a nicotine addiction and an oral fixation, which is a fertile ground for transitioning to smoking cigarettes and other products. In fact, a small short-term study of young adults without cardiovascular disease or heart disease risk factors found that several of the compounds were linked to significant changes in blood pressure, heart rate, and in constricting blood vessels, causing less blood flow to the organs. In fact, this was true both for regular cigarettes and for e-cigarettes. The American Cancer Society put out a statement in October of 2022, and I'd like to read from that statement for you. E-cigarettes pose a threat to the health of users, and the harms are becoming increasingly apparent. In the past few years, the use of these products has increased at an alarming rate among young people, in significant part because the newest re-engineered generation of e-cigarettes more effectively delivers larger amounts of nicotine to the brain. Many e-cigarettes sold in the US contain far more nicotine than e-cigarettes sold elsewhere, which increases the risk of addiction and harm to the developing brains of youth and young adults. With that, I'd like to introduce Dr. Sheikh Aliasgar Mugri, who will talk about some of the oral harms to e-cigarettes.
Okay. હવે કોઈ vaping કરે છે તો the heated liquids and aerosols with the mixed chemicals come directly in contact with the mouth. તો એ ઘણા effects હોય છે. The first effect હોય છે કે જ્યાં nicotine હોય છે, it's a vasoconstrictor, meaning it reduces blood flow to the gums and mouth. તો આપણે progression જોઈ શકીએ છીએ આ slides માં કે initially તમારા gum disease હોય છે, પછી તમે bone loss હોય છે, પછી eventually lose teeth થાય છે, and eventually you can get to tooth loss. So you can lose teeth as well through this progression. તો એક ચીજ છે addiction છે તો also frequency બી વધારે કરે છે. So as this frequency increases, this progression happens at a faster rate. બીજું effect હોય છે vaping is dry mouth. So આપણે જે aerosols હોય છે that are heated, they cause dry mouth. Now dry mouth માં હોય છે તો saliva is reduced, which causes increase in cavities. Next slide, please. So the cavities that are formed are usually they increase at a faster rate. Now, however, this vaping age group is at a younger age, so their oral hygiene is not the greatest, and also the food consumption of sugars is higher, so they increase more cavities. Thirdly, another issue that can result is tooth sensitivity. this is also because of the vapors and the heat. It causes tooth sensitivity. So a lot of people do not like to have any cold beverages, and they stay away from that. હવે બીજું effect હોય છે કે staining. આમાં chemicals હોય છે, તો chemicals ના result food coloring એ લોકો વાપરે છે. Food coloring ના લીધે staining બી ઘણું થાય છે. Now પાછું કીધું કે મુફરલભાઈ કીધું કે stimulant હોય છે, nicotine is a stimulant. Now because of that, teeth grinding is also an issue. So that can increase with grinding of teeth, headaches, and other issues. The final cheese hoy che vaping ma people like to use the vape in a certain way. To ek jagah par j muke che to oral cancer bhi ghanu thai che because it's just placed in one area and the chemicals and aerosols hit that area. So in conclusion, as a dentist, koi nanu koi atle a age group na and you see these factors, then you can realize that this person could be vaping and you can bring up the issues with them. So these are the main effects that can happen with vaping. I will now introduce Dr. Kadir Vaikakal, who is a pulmonologist in Los Angeles, critical care medicine specialist.
Audio.
Sorry, Shukran Ali Azhar bhai. I just wanted to share what are the effects of e-cigarettes or vaping in the lungs. This is an X-rays of a 25-year-old patient of mine who I just saw. If you look at the dates closely, this was a patient, 25-year-old who was vaping and came to the ER 2 weeks prior to this admission and came in because of chest pain and shortness of breath. And his x-rays looked pretty much normal when he first came in. He decided to leave against medical advice from the emergency room. And because he was so addicted to smoking that he was like, I got to go. And he comes back 2 weeks later and ends up with significant change in his x-rays. If you look at it, 2 weeks later on the January 19th, his upper lobes of the lungs are completely whited out. And it's related to vaping injury as smoke rises up and causes significant damage to the upper lobe of the lungs, and leads to pneumonitis. This guy actually ended up in my ICU on 100% oxygen and is still recovering from the vaping itself. So although the incidence of e-cigarette or vaping use associated lung injury, acute lung injury is small, but it could be potentially fatal. In the last year, about 70 deaths have been reported. And there was a recent article in New England Journal of Medicine where there were 98 patients admitted in the hospital because of vaping, and 30% of those ended up in the ICU, which is a significant amount. This is only a small aspect of what vaping and e-cigarettes can do to your lungs. There are significant other things that will eventually come out. As we all know, cigarettes 50 to 60 years ago was a thing to do. And it has led to significant amount of burden to the society, including chronic diseases as well as cancers. મોલા તો આપના ગેબના જાણનાર છે અને મોલાનું કરમ અને એહસાન છે કે આપને પહેલેથી આવી ચીજોથી બચાવે છે. ખુદા મોલાના બાવા શફીકને હંમેશા તારો કયામત દરાજ અને દરાજ કરે. Our next speaker I want to introduce is Safia bin Qaim Ali, who is a pediatrician based in San Antonio, and we'll talk about why children are vulnerable.
So, Jim, हमें शुरू presentation में जोयू the biggest factor behind why हमारा बच्चा इतना vulnerable थाई सके छे is because of peer pressure. बच्चाओं ने all of us, हमने એવું જોઈએ છે કે હમે સોસાયટીમાં accepted થાય, we want to be a part of a friend group, હમે હમારા friends peer સાથે વધારે વખત spend કરે છે, જે એ લોકો involved થાય છે, જે એ લોકો હરકતો કરે છે, sometimes we get influenced by that. So that's the biggest concern that we see, is that they get influenced by their peers. Other things that we see is sometimes as kids are getting older, એ લોકોને various કિસ્મના stress હોય છે, whether it be school, friends, family. These products get marketed to be helpful with stress, anxiety, whereas we know that's not the case. Instead, they have negative impacts, like we've been talking about in this presentation. These products also get marketed as being more safe compared to cigarettes. However, such nati, e-vapes contain as much nicotine as a 20 pack of cigarettes, and studies have shown that. So it is a myth that these products are safer. Sometimes बच्चाओं ने लागे છે કે એકવાર કોશિશ કરી લીએ, હમે addicted ના થાય. That's also not true. Like we've talked about, nicotine has a lot of addiction in it. And then boredom and weight control are also things that we've seen as why kids say they want to do it. Next slide. So along with our children, Ma Baba ni pan important role to step in and talk to their kids and say why these things are harmful and what they can do to help their kids. Like our speaker in Seven earlier talked about, she didn't know what to say in this situation because she had never been talked to about it. And so there's a lot of things that parents can do. And we have Dr. Lulu Abin, who is a pediatrician from Bakersfield, who's going to talk a little bit about how parents can step in and start the conversation with their parents.
Great, thank you. Jim Safia Benye Kidu, parents play a very large role in helping prevent substance abuse. I'll be speaking about that today. હવે यहाँ देखो तो तमने घनी अच्छी चीज नजर आवશે કે the numbers કમ થતા જાય છે. 2019 થી અડધા થઈ ગયા છે. અને શું motivating factors છે? એ લોકોને health નું concerns હોય છે, ફિકર હોય છે, મોંઘું બી પડે છે કરવામાં, અને addiction નું નામ આવી ગયું છે તો એ લોકો એનાથી દૂર થવું હોય છે. Next slide, please. एक चीज अपने जानવું જોઈએ કે ટીનેજર્સ ના દિમાગ કેમ ચલે છે. પહેલે તો પેઇન અને રિવોર્ડ સેન્ટર્સ હોય છે. ये દિમાગમાં પહેલા મેચ્યોર થાય છે. यानी બચ્ચાઓ પ્લેઝર સીકિંગ હોય છે અને પેઇન ને અવોઇડ કરે છે. તો નોર્મલી પ્લેઝર કેમ ઢૂંઢે? સ્પોર્ટ્સ सी, दोस्तों સાથે સોશિયલાઇઝ કરવાથી, જમવાથી, આ બધા એક્ટિવિટીઝ થી નોર્મલી પ્લેઝર સેન્ટર અને રિવોર્ડ સેન્ટર સ્ટિમ્યુલેટ થાય છે. મગર બચ્ચાઓની કેપેસિટી જે છે સોચવાની, પ્લાન કરવાની, પ્રોબ્લેમ સોલ્વ કરવાની, પોતાને કાબુમાં રાખવાને, ये જગા જે ફ્રન્ટલ લોબમાં હોય છે ये સબથી આખિરમાં મેચ્યોર થાય છે. 20 થી 25 વર્ષના ઉંમરમાં થાય છે. તો એનો મતલબ શું છે કે ટીનેજર્સ પ્લેઝર સીક તો કરે છે મગર સોચી સમજીને નહીં કરતા. નેક્સ્ટ સ્લાઇડ પ્લીઝ. તો એનાથી હાઈ રિસ્ક બની જાય છે. મુહર્રમાત કરવાને હાઈ રિસ્ક બને છે. આ લિસ્ટમાં અગર ગૌર કરશો તો દેખાશે કે ઘણી ચીજો ઘરથી જ શરૂ થાય છે. પેરેન્ટલ રિજેક્શન, એકદમ હાઈ અનરિયલિસ્ટિક એક્સપેક્ટેશન્સ રાખવો તમારા ફરજંદોથી. એના ઓપિનિયન્સ અને વિચારને ફુઝૂલ સમજવો, એ બચ્ચાઓને લો સેલ્ફ એસ્ટીમ થઈ જાય છે, લો કોન્ફિડન્સ થઈ જાય છે. ઘરમાં પ્રોબ્લેમ્સ, અગર પેરેન્ટ્સ મા બાપ ઓવર કંટ્રોલિંગ હોય या અબ્યુસિવ હોય કોઈ બી કિસ્મનો, તો આ સગલી ચીજ પ્રિડિક્ટ કરે છે કે હાઈ રિસ્ક બને છે આ મુહર્રમાતને ટ્રાય કરવાને. અને ખુદના ફેક્ટર્સ બી હોય છે, જેમ લો રિલિજિયોસિટી. ईमान अगर कम हसे तो ज्यादा चांसेस है कि मुहर्रमात ट्राई कर से. तो हाँ, मौला सी करीब था सो तो मुहर्रमात सी दूर रह सो इंशाल्लाह. मगर बच्चाओं ने अंदर ई शौक पैदा करवानी जरूरत है. फोर्स नहीं थई सकतो. ई वलवलो अंदर सी आवू જોઈએ. અને ખાસ ધ્યાન રાખે કે ડિપ્રેશન, એન્ઝાયટી, ADHD, attention deficit hyperactivity disorder, या कोई भी बीजा किस्मना मेंटल हेल्थ डिसऑर्डर्स भी होए तो ये डॉक्टर पासे जाइने इवेल्युएशन करावे, थेरेपी भी शायद जरूरत पड़े. કેમ કે ये સગલી બીમારીઓના ઇફેક્ટ્સને દૂર કરવા વાસ્તે ઘણીવાર બચ્ચાઓ આ મુહર્રમાત શરૂ કરે છે એને લેસન કરવા સારું, એને કમ કરવા સારું, કે એ ફિલિંગ્સ ઓફ એન્ઝાયટી ના આવે યા ડિપ્રેશન ના આવે. એમ ના થાય કે હમે હમારા બચ્ચાઓને માર્જિનલાઇઝ કરીએ અને ये જ બચ્ચાઓ શટડાઉન થઈ જાય અને કોઈ બીજા ગ્રુપ પાસે જાય या બીજા દીન ઢૂંઢે એક્સેપ્ટન્સ વાસ્તે. ખાસ મદ્રસાના બચ્ચાઓ વાસ્તે બી ધ્યાન આપે. ગુસ્સા મિલે છે, ઘણીવાર લિસાનો દાવત નહીં આવડતું એ લોકોને, તો સમજમાં નહીં આવતું મદ્રસા, તો એ બુલિંગ ને ના થવી જોઈએ. બચ્ચાઓ આપસમાં બી કરે છે અને મોલ્લેમાત અને મોલ્લેમ ખાસ ધ્યાન આપે કે એ બચ્ચાઓને નજદીક લઈ આવે. પર્સનલ સ્ટોરી કહું, हमारा जमातમાં બેન સાહેબ મારા જ બચ્ચાઓને હફતામાં 2-3 વાર અલગ ક્લાસીસ આપે છે, ખાસ એના વાસ્તે જ કે નજદીક ले આવવા સારું, તાકી એ લોકો દીનથી દૂર ના થાય. નેક્સ્ટ સ્લાઇડ પ્લીઝ. તો કઈ तरह આપણે બચ્ચાઓને પ્રિવેન્ટ કરી શકીએ છીએ કે એ લોકો શરૂ જ ના કરે, ટ્રાય ના કરે. કમ્યુનિકેશન ઇઝ કી. જેમ સફિયાબેને કીધું, કમ્યુનિકેશન જારી રાખજો. નાના ઉંમરથી લઈને મોટા તક. Frequently talking to them about Moharramaat is very important. કોઈ દેખાય રસ્તામાં તો એને પૂછજો બચ્ચાઓને પૂછજો કે શું કરે છે, તમારું શું ખ્યાલ છે, ને એ લોકોની વાત બી સુનવાની ઘણી જરૂરી છે. Have an open dialogue. એને ચૂપ ના કરાવજો અગર એ કાંઈ બોલે કે કૂલ લાગે છે કે કાંઈ, बिकॉज પછી એ લોકો એમ સમજે છે કે મા બાપને કાંઈ સમજમાં નહીં આવતું આજના જમાનામાં. બચ્ચાઓને એન્ગેજ રાખવાની ઘણી જરૂરી છે. એક્ટિવિટીઝમાં રાખો, સ્પોર્ટ્સમાં શામિલ કરાવો. નેક્સ્ટ સ્લાઇડ પ્લીઝ. ને ખબર કેમ પડશે કે તમારા બચ્ચાઓમાં કંઈ બની રહ્યું છે, એ લોકો કંઈ ટ્રાય કરી રહ્યા છે? તમે સુના જ હશો થોડી ઘણી ચીજો, બટ યુઝલી ફરક પડી જાય છે. એ લોકોના પીયર ગ્રુપમાં, એ લોકોના દોસ્તોમાં બદલી જાય છે. ઘણીવાર આ વેપિંગમાં ફ્લેવર્સ હોય છે, તો બેડરૂમમાં એ લોકોના બેડરૂમ્સમાં ઘણીવાર ફ્રૂટી જેવું યા ફલ જેવું ખુશ્બુ આવી જાય છે. સ્કૂલ પરફોર્મન્સમાં ફરક પડી જાય છે ને ઘણીવાર મૂડ સ્વિંગ્સ બી થઈ જાય છે. એક ચીજ આપણે ધ્યાનમાં રાખીએ કે ઘણીવાર આ બધે ચેન્જીસ આવી જાય તો it could be related to a mental health disorder, depression या anxiety જેવું. So that should be evaluated as well. Next slide, please. હવે આ 4 parenting styles છે. એમાં authoritative parenting style has been shown to be preventative in preventing children from pursuing substance abuse. Authoritative, which is the blue box there, our parents are warm and responsive. Rules are explained. Children are raised this way. They generally have good emotional control, are resilient, and they're able to bounce back with adversity. They allow children to help with making decisions. There is a two-way communication. They connect before they correct. These aren't my words, by the way. Whereas the opposite occurs in authoritarian parenting style, the yellow one. This is the my way or the highway, bas ke diya walo parenting style. These children develop low self-esteem. They're generally, the parents generally degrade the child, and they do not care about the child's perspective. They think feelings and sadness are weaknesses. Keep in mind, authoritative and authoritarian parenting styles both have high expectations, but authoritative parenting style takes into account the child's perspective as well. Next slide. So how can parents get involved? They can improve two-way communication, very important. They need to respond instead of reacting. They need to assess for mental health disorders, because those can all contribute to substance abuse. Nazdik liavo bachchaone, khas nazdik liavo. Inshallah, small videos will be distributed to help Mu'mineen parents navigate the proper parenting techniques and approach to prevention and cessation of substance abuse. And inshallah, Molani dua si yari milse ke hame sagla hamara bachchao sath hai, we can connect before we correct. હવે અલિયાસગરભાઈ દિવાન, medical student from New Jersey, કહેશે about resources.
Shukran, Dr. Luabin. So in terms of resources, આપણે થોડા resources ના બારામાં વાત કરીએ. ઘણા resources છે, sites છે, apps છે that are freely available, જેનાથી ઘણું ફરક પડે છે. આપણે કોઈને આ ચીજમાં મદદ કરવું હોય તો ઘણા એહતમામથી કરવું જોઈએ, very carefully કરવું જોઈએ. એમ ના થાય કે આપણે કંઈ ગલત વાત કરીએ અને પછી આપણી જે original જે ગરજ છે એ ભૂલાઈ જાય. એક હિસાબથી this is a very big zimmadari, it's a very big responsibility. તો આપણે કોઈના સાથે આ ચીજમાં બારામાં વાત કરીએ તો we first આપણે પહેલા એમ ખબર હોવી જોઈએ કે આ શું છે. You want to know exactly what you're speaking about, and these resources are here to help you. So like American Heart Association છે જે કોઈ આપસી કોઈ સુનો હશે, they're very big advocates on nearly all public health issues. They specifically have a tobacco-free schools toolkit, resource toolkit, and also peer-to-peer platform. So our tobacco-free schools toolkit it's a set of policies to create, also to educate students and support them in any efforts in fighting what they call as an epidemic. So basically हमने यहाँ सुका मुकाई से कि इनके घना लोग शायद मदरसा में खिदमत करता है या बीजी चीजों में मदारिस में खिदमत करता है. These are policies that you can enact to help. They also have a resource site at heart.org/anti-vaping. It's also बच्चा वास्ते भी है, माँ बाप वास्ते भी है, and counselors वास्ते भी है. And there's also links to Tobacco Endgame, which is a peer-to-peer platform. જેમાં ઘણા બધા stories लिखे છે लोगों, young people that have gone through this addiction and have overcome it. Also, the American Lung Association, they have a guide called How to Talk to Your Kids About Vaping. The common questions and answers. And the US Surgeon General also has a tip sheet for parents. Easily basically, the idea is to talk about these things in a non-judgmental attitude and how to keep the conversation going. Resources conversation it won't make a difference. Other resources to help if you yourself are going through this, or if you know someone who is again the Tobacco Endgame platform, and also a collection of apps. So there's a site called Sideline, which has several apps. They're all free. This is quitting app, it's activities, counseling, Quit Start app, and the Smoke-Free Text for Teens, which offers advice, support, motivation. You can text them and someone will respond to you. The Truth Initiative, which was very, very big on the entire anti-cigarette, anti-smoking advocacy campaign in the 90s and early 2000s. They have a mobile program called This Is Quitting. And so it's very special because it helps at every step of the process, whether you're just contemplating or whether you're actively trying to quit. And basically, and if you know someone who is going through this, and these are all the mentioned links and PDFs guides. Last up, back to you, Dr. Anand. Shukran.
Shukran, shukran to everybody. I want to just remind everybody that if you have any questions, the question and answer session will be beginning now, and you can WhatsApp your questions to the number on the screen. I also want to dovetail on what Ecigs said, which is that, as physicians, the first rule that we learn on the first day of medical school is confidentiality. And if you need resources, if you need somebody to talk to, I can tell you that the physicians in your community or the physicians of SDMA will be available. And I can assure you on behalf of our members that it will be kept strictly confidential. So sometimes it helps to have somebody in the community who you can talk to. Please avail yourself of the human resources as well as the electronic resources that Ecigs provided. So please feel free to do that. We have one question that has come in already, and I think Sheikh Mustafa Bhai, if you're still on the call, I'd like for you to take this question. The question is this: there's been a lot of talk of nicotine, THC, CBD, and some of these haram substances in e-cigarettes, but many of the e-cigarettes are marketed as containing no nicotine or containing no THC or CBD. Are these haram as well? Are you on the call? Can you take that question?
Yes, I'm still on. So I mean that's a very good question because you know you would say okay the nicotine is there to na hoy to pacha haram kewai ke na kewai. So there's a multifaceted answer to that. We'll start from you know je Rasulullah ni je hadith che ke ma kasara qalilahu kathirahu fa qalilahu haram ke जे भी चीज छाग यानी nasho what we call intoxication or you know in this any effects on intellect or intoxication even in ghanu bhi like tamne ghanu joy to become intoxicated from it to inu thoru bhi haram che. That means even if a very large amount is required to have intoxication, then even a small amount of it is considered haram. So in that regard, you know, if you look at the statistics on the FDA, the website or the CDC, they say about 99% of all vaping materials have some degree of nicotine or these the THC type chemicals in them. They're never truly nicotine free or THC free, about 99% of them. And that falls under that category. And then because like there's a threshold that most reporting agencies require that if it's under a certain percentage amount, then you can claim it to be nicotine free. And we see that same comparison in alcohol. When someone says this is alcohol free, it can say 0.0001% alcohol. And that's how they can get away with saying it's alcohol free, but it still contains some degree of alcohol in it. Have agar suppose kare ke completely nicotine hoyad na. So I think Dr. Amir or Dr. Kalka may have mentioned this, is that the vapor, or even Dr. Mufalabai had mentioned the vapor aspect itself contains many particles in it that when inhaled can cause pulmonary or other significant damage to the lungs. Have ए बड्डू बुकी ने एक चीज करे के अपने जोए के जे हमना जे मोला जे बतावे छे કે આ હલાલ છે આ હરામ છે અને દુનિયાના અંદર બદલતું જાય છે એડવાન્સમેન્ટ થાય છે પણ શરીયતના સાહેબ કાયમ છે અને શરીયતના સાહેબ જે ફરમાવે કે આ મિસલ આ હરામ છે તો એનો સવાલ જ નથી અને મોલાએ સાફ ફરમાવી દીધું છે કે આ મિસલની કઈ બી ચીજ haramna category ma ave che. So whether it's nicotine free is basically for us a mute point at this point, because this all falls under the form of being haram, because as mentioned, it can lead to, as Dr. Amir, you had mentioned, that these habits have shown increased risk of smoking later on. So they all fall under that haram category. Oh, I think we got you on mute, Dr. Amir.
I spent half an hour telling people not to open chicken meat. Thank you so much, Dr. Mustafa. One quick question that I think is that are the slides going to be made available? Yes, inshallah, the slides will be made available on our website, sbmedical.org. A question for Dr. Safiya Ben, Dr. Lulua Ben. What steps can kids take to resist peer pressure? It can be overwhelming. What tools can we empower our children with to teach them to resist this overwhelming peer pressure? If either of you want to take that with you.
Yeah, so before Dr. Lulubin, if you don't mind, I'm going to chime in real quick. So I know a lot of schools, I went to school here, and in the elementary schools, we went through a program called DARE, which was, you know, standing up against any type of alcohol, tobacco use. I want kids to think of this e-cigarette vaping category to fall under that. So having that confidence that you know what's right for yourself, kind of like what Insia Ben talked about earlier, that she was in that situation where it was her own friend. Sometimes that situation becomes a little bit more difficult because this is a person you know really well. You don't want to make things awkward, but at the end of the day, you need to look out for yourself. You need to look out for your health. You need to look out for your iman. So gathering that courage and knowing that what you're doing is right for you. 9 out of 10 times, if you're in a crowd, there is going to be someone else there who's going to see that you're uncomfortable, and they will stand up for you. They will make sure that they voice that, hey, this person does not want to do this, please don't force them. And God forbid, if you're not in a situation like that, just have confidence in yourself that, you know, this is not something you want to do, and say that. Some things I talk to my parents about, like the patients and their parents, is having these open conversations. Sometimes it can be difficult initiating these conversations because parents are like, I don't want to talk about it, because if I don't talk about it, my kids aren't going to know about it. And that whole, you know, if I don't bring it up, it doesn't exist. Unfortunately, that's not true. We've seen the numbers. Kids are being exposed to this at very, very early, young ages. So the earlier you have the conversation and the earlier you tell your kids why this is not good for them, and kind of have that open conversation and build that trust between your kids that you can have open conversations, I think that's going to be important. You don't want your kids to feel like if they are in a situation that they don't feel safe in, if they come to you, you're going to judge them, because then you kind of cut yourself off and then they rely on other people who may not give them the best advice. So be a friend to your kid. Tell them, like, we're here for you. Like Alias Gurbai has also talked about, we can't judge. This is a judgment-free zone. We're all here to help you. And having these open conversations, I think, is going to be the best way you can step in for your kids.
I think Safia Ben answered that very beautifully. I think additionally, things that kids can do is just get engaged, stay busy. Most of the time, many times it's not just because of mental health issues. It can be because of that, if they have anxiety or depression. But sometimes it's just boredom and they're curious. Hamna Kale Madrasa ma, we presented this topic as well. Jim, Akka, Dunya Matthew, Alhamdulillah. And somebody had mentioned that there's a show that kind of is put on, a performance with vaping, because of the smoke that occurs. It's so much bigger and broader than cigarette smoking. And so it's kind of a bit of a performance. And so people get drawn and attracted to it because of that. So there's a bit of curiosity. So keep them engaged, keep them busy, put them in sports or other types of after school activities, and keep them, know who their friends are. Bring their friends home when they want to play, instead of sending them over as much. So I think those are things that you can do to, and the open conversations, as that's very important. And role playing, I would have to say as well. You want to do more role playing where you create an example of a scenario where the child might encounter, and ask them, how would you handle this? How would you say no? How would you respond?
That's great. I think the point of having your children over rather than sending them, or having your children friends over rather than sending them, is an important subtle point that parents can put into play right away. We have time for one last question, which I'll take myself. This came through. My kids tell me that e-cigs are not like regular cigs. How do I handle that? I think the simplest way to handle that would be to say it's true. E-cigarettes are not like regular. E-cigarettes, as I showed before, have much more nicotine and much more readily available nicotine to the bloodstream than regular cigarettes. I think Lulu have been mentioning that each e-cigarette has about a 20, it's about the equivalent of 20 cigarettes. It is much easier to hide, so it's much more subtle in its addictiveness, because you can get away with it for longer before somebody finds out. So e-cigarettes are not like regular cigarettes. They're actually much, much worse. On that note, I would just like to thank all of our speakers who devoted their time for preparing for this talk and giving this talk. But most of all, if we are going to thank anybody, and the Molani Shukararaz Kariye kya nakis cheez si हमने बचावी રહ્યા છે અને हमने આ ખિદમતમાં શામિલ કરી રહ્યા છે અને આ જે તબીબે રૂહાની મોલા છે, અસલ તબીબ તો મોલા જ છે. એ તબીબે રૂહાનીના ઉમર શરીફને તારોઝ કયામત દરાઝ દરાઝ અને દરાઝ થાય. આમીન. આખિર દાવના અલ્હમ્દુલિલ્લાહ રબ્બિલ આલમીન. As noted, you will be getting a feedback form, and you will be able to ask any other questions on that form as well. So with that, we would like to thank all of you for joining us today.